Every month, IRS agents will verify that 300 million Americans have purchased health care acceptable to government. They'll also be verifying that employers have insurance that's acceptable to government. And the IRS can now share confidential taxpayer information with the Department of Health and Human Services. And if the American people or employers don't comply with what the IRS wants, they have the power, Glenn, to levy fines of 2% of a person's income or over $2,000, whichever is greater. This should make the hair stand up on the back of people's necks to realize that now it's up to the IRS to enforce this health care bill.
Okay. Thank you, guys. We will see you again and again. They're asking people to be in Washington at the Capitol Saturday at noon. By the way, just a quick note to Jon Stewart, another thing that I've been called crazy for. I said, remember what the progressives do. They didn't have the FBI enforce prohibition. They had the Treasury Department to do it. It was about power and it was about money. Gee, who's in the Treasury? The IRS. They will be the enforcer of health care now. Sorry we got it so wrong. Back in a minute. Here with me now, former Pennsylvania Senator and Fox News contributor Rick Santorum and Massachusetts Treasurer Tim Cahill, who is now running for governor in Massachusetts as an independent. Let me just ask one question. I have to do a follow-up. We went to Washington, so we were interrupted on our conversation what's happening in Massachusetts. Did Romney care? Is patient care better or worse than when it started?
I don't know the answer to that. I don't know if it's any better or any worse, to be honest with you. I'm not 100% sure. I think it will get worse if these community hospitals do close or go bankrupt.
Rick?
It'll get worse when they start to ration care because they can't afford it. I mean, what Tim was talking about is that the federal government came in with this stimulus package and pumped up all of these state Medicaid programs, which is where most of the folks in Massachusetts have gone. Once that's over, guess what happens? Then the state's going to have to say, we can't afford this anymore, and they're going to have to start rationing care. When they start rationing care, then the people who are really sick, the people who are on the margins of life, you know, those little kids who are born with genetic defects or those older people who have terminal diseases, all of a sudden we're going to start to say, you know, we just can't provide the level of care for these people who don't have, quote, useful lives, and we've got to focus our attention other places.
What happened? What? You know, do we have the quote from the Moody's report? Put the quote up here, will you? Here's Moody's says U.S. debt could test AAA rating, but in this report, fiscal adjustments of a magnitude that in some cases will test social cohesion. They're saying if we don't want to lose our AAA status, which means, well, I mean, we can't lose it, or we can't pay for our debt.
This is under the existing.
Yes, what we've got right now.
Not even talking about adding another $1 trillion,
no.
Or if you look at the real 10-year cost, about $2.5 trillion.
Got it. They're talking about we have to make such deep cuts in our spending that it will test social cohesion. In other words, civil unrest.
We're going to talk about, look.
What happens to us from here? What happens to us?
Well, right now they're playing a game. Right now they're playing a game that they're going to put all these taxes on the wealthy people. That they're going to, if you look, this is a new social. This is a new social welfare program that you said. It's a new social welfare program that is going to be paid for, unlike any in the past. Medicare and Social Security, big social welfare programs spread across everybody. Everybody chipped in. There was social cohesion because if you were lower income, higher income, you all participated. This is different. This is going to be paid for by people who are going to see a Medicare tax. If you're over $200,000, you're going to have an increase in your Medicare tax. And by the way, you're going to be taxed on your unearned income, but only if you're over $200,000. All these things that are going to go into place, they're going to be focused on trying to hit the rich and hit, you know, corporations. That is not how we've ever done this before, and that's one of the reasons I think you're going to see when the rubber hits the road, you're going to have problems.
I just advertised for a position in my company here in New York. 450 resumes. The common thread is you look at the resumes, terminated 2008. Yeah. I mean, people haven't, it's 2010.
Right.
People haven't had a job for 2 years. Now, you're hitting these people who are rich. They're the job creators.
Right. Exactly. Well, our experience in Massachusetts, this bill was passed before the recession hit. And that's why all the projections were rosy. But we're still at 9.5% unemployment. It's hard for small businesses to hire people because they have this mandate now that they have to cover everyone or pay a fee or fine for it.
So when we come back, I want to ask two things. You from the national side, and don't talk to me about what, well, they'll never do it because of political reasons. No, no, no. What needs to be done? And you from the state side, can you ever get rid of Romney Care? Can you ever get rid of this?
No, we're going to keep it and we're going to make it work.
Okay, so what needs to be done? Back in just a second.
President Obama is leading the final push on the health care reform bill as it heads to a possible vote this Sunday. At a campaign-style rally today, the president said if the vote fails, quote, the insurance industry will continue to run amok. The president will meet with Democratic caucus members tomorrow, trying to lobby undecided votes. Meanwhile, Republicans, including Minority Whip Eric Cantor, say the Congressional Budget Office score of the bill, how much it will cost, is part of the Democrats' health care trickery. Stay tuned all weekend for special Fox News coverage of the health care reform debate and possible vote on Sunday. Glenn Beck returns in a moment, but first, Brett Baer previews special report. Hi, Brett.
Hey, Patty Ann, coming up, Republicans are dissecting the Democrats' newest health care bill, while Democrats are counting heads and twisting arms in the push to that Sunday vote. Plus, what's happening on Iran as all of this is going on? Join me in 28 minutes for a special report. But now, back to Glenn Beck.
We're just talking in the break on, do you really think this is going to pass? And